I'm going to go over today cellular terrain theory versus germ theory. It doesn't sound like it's very exciting, but to me it is so exciting. It really lights me up, and it is exactly the philosophy of Brio and how we treat, and always has been and always will be. It may not be overtly stated. I think I try to share as best as I can with my patients, but they may not fully understand that there's two schools of thoughts. So I allude to it in most of my Facebook Lives. I also talked about it when I talked about the supplement industry trying to do natural supplements with the medical model. I was kind of alluding to it too, but today I'm going to actually go through it and just listen with an open mind. Know that a lot of what we're taught is, hi Sippy, a lot of what we're taught is not actually always fully the truth. And when you know that, you can be empowered to make decisions. And it's not about disregarding one side, one theory. It's about knowing a deeper level of truth. So that's really what I'm here to share. And this is what I embody every day. And I also still have to carry my asthma inhaler. I still, for years it's been since I had to take medications, but you know, it's still there, and I know when I need it. I'm under the correct care of someone who's basically entirely dedicated his practice to cellular terrain theory, and so we know when things are needed. So there's a mixture of both, and it's never a one or the other camp. But however, what I'm going to show to you today is our society is pretty much 100% in one camp, and there's no thought process to the other, whereas I'm mostly on the other camp, but I don't reject the camp of the majority because it is needed, and I've seen the need for it, and it's part of the healing journey. We can't reject it. So talking about cellular terrain theory versus germ theory. This is basically the whole basis of my practice. This is how I was treated to get myself out of horrific asthma, life-threatening asthma, anaphylactic allergies. My mom used to have to cook on the porch for 6 years because my allergies were so severe that she couldn't even open a package in front of me in the house. So she had to cook outside, and that led to total just shredding of my gut as I went along. All the pharmaceuticals used to treat my just immunocompromised system, all the bronchodilators, steroids, all of that stuff, all these years to just keep my symptoms at bay. And then as I start to embark on how my naturopath treated me, and then I had to do the same, adopt the same philosophy in my practice because it was just a no-brainer. It was the only way my brain could function. And I would say even a majority of naturopathic medicine, it was not this theory. So this is additional theory that I trained in for many years after graduating from naturopathic medicine. So let's get into it. So the discussion of the cellular terrain, and when I say terrain, maybe because I'm not speaking clearly, it might sound like train, like T-R-A-I-N. It's not train, it's terrain, like the quality of the road kind of thing. So cellular terrain, I actually have notes, so I'm going to read, and I'm going to try to free flow too. Most of my other talks have not been reading at all. It's just free flow, but this is very important, and I'm trying to explain a very difficult concept as clear as I can with as simple analogies that I can. So the discussion of cellular terrain, whether it's known or unknown, is the root of the Brio living philosophy, the way that we all practice at the clinic, whether it's body work, whether it's Bowen, whether it's acupuncture, whether it's with me, with the Unda remedies, whether it's with the Physica and the other drainage remedies. It's all the cellular terrain theory. So it's the basis of our 4-level program of weeding, seeding, feeding, and thriving. And this is taking a patient from severe or mild symptoms. It can be anywhere from life-threatening to just mild symptoms, ultimately to get them to thriving, which is cure. So the germ theory, this is cellular terrain theory. So the germ theory is modern medicine. It is the way that we're taught to look at medicine. There's a germ, we have to kill it because it's gonna affect us, and it's the outside world that we are worried about. It is also modern agriculture, so we no longer, because of mass production and mass shipments and mass quantities, and basically I think it's just, you know, profitability to do things fast and in mass. It's about even the chemical fertilizers or the chemical pesticides, so we can quickly make sure that the bugs are killed and everything, versus ensuring that it's like a biodynamic farm, which takes a lot more care and process to cultivate, and they don't get the rampant weeds and the animals and the bugs destroying the entire crop culture, because they know how to work symbiotic with nature, versus the germ theory is also used in modern agriculture. So we don't have time to cultivate any of that, but let's spray everything, kill the bugs, and make sure that the soil is, the weeds are killed via spraying with chemicals, and then we'll grow the food. Modern food processing is the same. Let's sterilize our food, make sure there's nothing in it, and it'll be sterilized and clean, and then we send it out, and that is part of the modernized food chain. So this germ theory is deep, deep, deep. I'm just talking about like a little sliver of it today. So I'm a really visual person. I like to know the why and the how. Somebody can treat me, but my mental is so strong that if I don't know the how, I can do all the things necessary, but until the how and my mental clicks, then my body will follow suit. So if I can understand something, it just unlocks everything. So I've spent many, many, many years on trying to figure out how the body heals, because when you're trying to help somebody through such a horrific health situation, you have to know what you're talking about. You cannot just guess. And when they're aggravating, which will happen in the cellular terrain theory, which I'll get into, you have to know what's going on. Otherwise, when they're freaking out, you can't contribute to that, because most practitioners will be like, well, I didn't do this to you, and maybe you should go somewhere else and all that stuff. But when they're in the trenches of it and they're totally aggravating, you have to know what you're doing. So I've studied many, many, many hours on healing. And I feel that it's a complicated symbolism to understand, but it's a complicated theory to understand, but symbolism helps patients understand it. So I'll give a few analogies of the symbolism of cellular terrain theory as compared to germ theory. So the one I always tell my patients is the first visit when they come in, I always try to explain to them this philosophy of care, because they will get it. So Jatinder just popped on. Hi, Jatinder. They will get it, and I feel like when they know what my philosophy of looking at a problem is, they will be more compliant, because it's not just me randomly pulling shit out of my ass and like, hey, take this, take that. Let's try to get this, and they know from the beginning, this is how I'm looking at the health situation, and it's not going to falter from your first visit till your 100th visit. So when a patient comes in, I tell them, look at your body symptoms from birth till now. Anything that you've had and has grown out of or gone away or was medically treated, it's never really gone away. It's just transformed and changed shape over life. So you could have had ear infections as a kid, then that was grown out of, then it was chronic tonsillitis that was either grown out of or the tonsils were removed. Then at puberty, there's menstrual issues, and then the birth control pill was maybe applied, and then later on there's digestive issues. So when I'm doing the health history, it was like I had tonsillitis as a kid, but then that went away. I got surgery. Then I had hormone issues, but then I went on the pill, so my hormones are fine. Now I have this digestive issue. So you can see how it was just like nothing was really dealt with. So to me, that's like a garden where there was a weed, and then the focus was only solely on that weed and get that weed to go away, whether we cover up the weed or we just pulled it out. And when the weed, aka the symptom, is gone or not visible to us, everyone thinks that the job is done and we've done a great job and we can move on. Whereas the way I would look at it is that's just treating the tip of the iceberg, the tip of the issue. That's just treating the red flag. So what often we will see in a person's health progression is that you pulled out the weed or treated the weed, and now it'll just take a couple months or years till the weed comes back, or it'll come in a different part of the garden and look like a new symptom. So then onwards, and then we'll think like, even if they saw a natural practitioner, that practitioner was awesome, they helped me with my tonsillitis, but now I have to go back because I have hormonal issues. So now it's a new weed, and it's all about treating that weed and getting that weed to go away, and then so on and so forth. Whereas in my point of view, it's not really about the weed at all. It's about the soil that can host these various weeds throughout your life. So what's the commonality? The weed might look different throughout life, but the commonality is the soil that hosts the weed is the commonality. So if the soil is not optimal, it's not able to self-regulate, it's toxic, it's not able to detoxify, it doesn't have the proper diet, hygiene, all of that, mental, emotional, it cannot treat the weeds. So as you start to treat that soil and turn that soil over, the weeds will naturally not be able to survive in that environment, or they'll just recede. And that will treat the various 4 different weeds that we've had in our life. So it will treat the tonsillitis, it'll treat the hormone problems, it'll treat the digestive problems. And it's not just one thing is separate and then we go on to the next separate thing and we go on to the next separate thing. The connection is the soil. So the germ theory is just treat the weed, and the cellular terrain theory is treat the soil that hosted the weed. So why is the weed able to survive in that environment is the bigger question. Not just pull the weed out, it's how is it able to survive? And I can apply that to any health situation. Does that make sense? That part so far? I'm gonna try not to motor through this because there's so much to talk about, and I think yesterday during my Facebook Live I talked like 4 million miles a minute. I don't know why, but I did. I was very excited. So does that make sense? So there's a heart. Yes. Okay, so that's one analogy, one symbol of the cellular terrain, and I always use the garden analogy. So when the garden is lush, we even have a cartoon about it on our website. Feel free after this talk to go on our website, www.yourbriohealth.com or CA, and check out our cartoon. It illustrates the cellular terrain theory to a T. I don't say it specifically, but it is. That's the cellular terrain theory. So when you turn over the soil is healthy and vibrant and thriving, has sunshine, has oxygen, has proper nutrients. That weed cannot survive. So when you've just pulled up the weed and then the soil is still toxic, it's just setting up for another symptom state. Another analogy I really like to use is, say in your backyard there is some flooding that happened. There's a little dip in, like the backyard slopes down a little bit, and there's flooding that happened, and now there's this big pool of water and you can't get it out. So you don't have any resources to actually treat it yet. So that water is sitting there. It's sitting there for months, and maybe even refilling. That water is now stagnant. It's destroying the grass below. And now perhaps there's the stuff that can bubble up and bubble over. Maybe off wastes and toxins are able to totally survive in this environment. And now in your backyard, you have tons of mosquitoes being attracted to this swampy water. So modern day germ theory would be, let's treat the mosquitoes, let's spray them with whatever mosquito killer we have, and then spray ourselves with a DEET product to make sure that we don't get, and let's camp out in the backyard and hang out there, have parties, like just love our life and pretend that swampy water is still there. And then we're spraying ourselves with some DEET product to protect ourselves from the mosquitoes, and then also spraying something to actually kill the mosquitoes. That is perfect germ theory. So in cellular terrain theory, what I would do with the body, using it as an analogy, is the mosquitoes are not the problem. They did not cause the swampy water. The mosquitoes are a byproduct of the swampy water. So we need to drain that water, whatever means necessary, spend time to heal that grass, replant the soil, make sure the grass is healed again and able to grow properly with whatever expert necessary to make sure that grass is fully back intact. Make sure that there's healthy water, the nutrients of the soil is there, fertilized, whatever it is, and in time that grass is healthy, and now mosquitoes are no longer there. So the mosquitoes are never an issue. They were the byproduct of the diseased soil state. Does that make sense? That is totally cellular terrain versus mosquitoes and killing the mosquitoes. So if you keep killing the mosquitoes and you have to keep swatting them and you're partying and hanging out in the backyard, you're gonna always have to be worried about the mosquitoes and really cover your body, and or always have someone dedicated to just warding off the mosquitoes while you're trying to enjoy your backyard barbecue meal and party. Does that make sense? That's another analogy that I really, really like. So Donna's throwing some thumbs up. A third one I really like, and this one kind of hits home for a lot of people, is let's say you have a toilet. Everyone has a toilet, I'm assuming in this modern world. You have a toilet, the toilet is backed up, it's clogged. Let's say there's feces clogging it, it's totally backed up, and you keep flushing it, semi-flushing, but it's totally backed up. The toilet hasn't really been cleaned either, so it's pretty grimy and nasty. And so now there's flies in the bathroom, and so the drainage is plugged, the plumbing is plugged, there's feces almost blocking the whole tubing of the toilet. Toilet hasn't been cleaned from the inner bowl, it's just pretty nasty, it's smelling rancid. Now there's flies in your bathroom. So you can go in with an electric fly killer and Lysol and just spray it everywhere and try to kill these bugs and perpetually kill these bugs. Still trying to use the toilet because it's still semi-flushing, but it's pretty nasty. So there's flies everywhere. It can even eventually attract rodents and other insects that are pretty nasty. You can continuously use this toilet. The analogy would be stuck lymph nodes, stuck bowel movements, stuck cellular toxins in the cellular terrain, and now you have bugs in the system that are attracted to this. So what do you need to do? Do you need to get fly killers? No, you need to clean that toilet, get an expert to clean that toilet, clean the piping, clean the drains, clean the shit literally out of the toilet bowl, like sparkling clean. Make sure it's clean, fresh water, open up the windows, air, and the flies will not be attracted to this disgusting bathroom. They will no longer be perhaps rodents, hopefully, or any other insects that are attracted to this terrible state of the bathroom. Does that make sense? That is the electric fly killer and whatever to prevent any bugs coming in is the germ theory, and the cellular terrain theory is clean the drainage, clean the plumbing, get it repaired, clean the toilet bowl, get it totally spick and span clean with hygiene. Does that make sense? That is also the cellular terrain theory versus the germ theory. Give me a thumbs up or a heart if that is resonating. Those are three big analogies that I like to use because you can't deny that. I think everybody's seen that. Everyone's seen like sitting water or sitting puddle for like months and months and months. It's pretty nasty, it can smell. That happens in our bodies. We can't see it, but the symptoms are telling us that it's happening. When you have a symptom, it's happening. So there's many philosophers that we don't know about because we only know about the germ theory. So Donna's giving likes, Jatinder's giving likes. I think they're getting it. They know it. They've lived it. I can say that with confidence. There's many philosophers, many scientists that we likely don't know about that have all tried to explain about the cellular terrain theory, but modern medicine is all about germ theory. So Dr. Rudolf Virchow, I don't know how to say his name, is known as the father of pathology. So pathology means the study of disease. So he made the statement, if I could live my life, so he's known as the father of pathology, the state of disease. If I could live my life over again, I would devote it to proving that germs seek their natural habitat, diseased tissue, rather than being the cause of diseased tissue. So they seek their natural habitat, which is the diseased tissue that's already present, versus they don't cause the diseased tissue. For example, and he writes, and I didn't know that he did this, I just found this while studying, because I use that mosquito analogy all the time, and he writes, mosquitoes seek the stagnant water but do not cause the pool to be stagnant. Does that make sense? Totally makes sense. When you think about it, it's a total mind warp. So he's saying that the mosquitoes that are coming in the backyard didn't cause the water to be stagnant and diseased. They're coming as a result of that being their natural habitat because of the diseased water. This is what happens in our bodies. This is the germ theory versus the cellular terrain theory. So he is the father of pathology, and he said if he could live his life over again, he would devote it to this theory of the cellular terrain. So the backed up toilet, the spraying of Lysol, and the electric whatever of the germs is the germ theory, versus a deep clean is the cellular terrain theory. Another one that I've seen recently, I think because of the state of what's going on right now and us having to be quarantined, which I'm not debating at all. So Shelly just popped on. Hi, Shelly. I'm not debating that at all. I'm just giving theories that date back to like 1800s. So another thing I've seen on Instagram is if you have a fish tank and there's a goldfish in the fish tank, the germ theory is if that tank is really getting dirty, just pull the fish out and put it in a clean bag of total clean water, and it's still residing in the dirty fish water. Whereas the cellular terrain theory would be clean the fish bowl, get out the water, clean the fish bowl, and then the fish doesn't have to be protected in its little bubble against the dirty water. That is also cellular terrain versus germ theory. So the difference, another example I always like to use, and I use this all the time, and people get it when I ask these questions. They do get it, whether it's for a flash second, but they do get it. Let's say 3 girlfriends went to Cuba on vacation. They're eating at the resort, which is a set buffet. They're eating the same foods every day. They're eating, having the same drinks, having the same water, filtered or not. One of the girls comes back and gets a parasite, and the other 2 do not. What is the difference? If there's the germ theory, a parasite is a parasite is a parasite, it should affect all 3. What is the difference? The difference is the cellular terrain of the 3 is different. So one might have been more susceptible to allow that parasite to set up shop and be a host for the parasite, versus the other 2 may not. So if it was the germ theory throughout, all 3 of them coming from North America should have gotten the parasite. Does that make sense? But often it'll be like one of the family members got sick, one of the party got a parasite, one of the whatever had stomach issues. That is all because of the inner cellular terrain, which takes time to heal. It's not something that you can pop a couple of vitamin C's. It's not at all about that. It is a process. And, many of my patients have been on this journey, and people always ask, like, how can you have patients stick with you for like 10, 12 years? I even saw my first patient a couple of years ago. My first patient when I started practicing, she came back and still I saw her because right off the bat, I was treating her with cellular terrain. And so we had a good relationship right off the bat, and she trusted my theory of how I treat. And so I had many naturopaths, and none of them treated with cellular terrain. It was all supplement heavy. I didn't really notice the difference because when I stopped the protocol, I didn't really feel any difference. And when my naturopath started treating me in 2004, I'm still doing the protocols. Still, to this day, without fail, twice a day, take my under remedies. So I'm always treating the cellular terrain. You can't just let that backyard grass grow because you focused on it for 6 months, The chances of it filling up with bogged up water in our modern society it's inevitable. We don't live in this clean, like idealistic world. We have to always focus on the cellular terrain. So it's not just a quick magic bullet theory, but the germ theory leads more to quickness, whereas the cellular terrain theory leads to how did it get there. Not at all impossible. I hope it doesn't come across when I talk about it that it's impossible, so might as well just stick with the germ theory. That's not at all the case. It doesn't have to take 14 to 20 years to get to a well state of wellness. You can get there quite quickly, but you have to maintain it, and that could be forever, and that's fun. So when you're treating that way, it's more of a fun way of healing versus like you're always chasing the bug. You're always chasing the next bugs, and that's really not a fun way to live because you're in constant like hypervigilance looking for the next bug. So the cellular terrain, I'll get back into that a little bit more, but the parasite one is really it's a good one because everyone can relate to that. So if it was through and through, the parasite should have latched in everyone's gut, and it doesn't. So another quote: "The specific disease doctrine is the grand refuge of weak, uncultured, unstable minds," pretty harsh, such as now rule the medical profession. There are no specific diseases, there are specific disease conditions. And this is from Florence Nightingale. So these are not modern day quotes that I'm reading to you. These are old quotes, well-cultured quotes. So again, I'll read it. She says, "The specific disease doctrine is a grand refuge of weak, uncultured, unstable minds, such as now rule the medical profession. There are no specific diseases, there are specific disease conditions." So she's also talking about the cellular terrain, the disease tissue, which then attracts the germs. So that's what she's talking about. So this one is a biggie. Let's get into it before our time really comes out, because this part is huge. So the history and an alternate view of infectious disease. So this one's a really kind of common disease, germ theory versus cellular terrain. This is a big kind of like us versus them. So traditional cultures used to have cow's milk, and they used to have straight from the cow or the buffalo in the backyard. Many people their families have been in Canada for generations, they grew up having cow's milk, and it was raw, and it was from the backyard or back farm. My parents, especially my dad, how he grew up, there was a buffalo and a cow in the backyard, and they drank raw milk from the buffalo or the cow. Yes, it could have been heat treated on the fire, but they primarily, everything that was cultured dairy was made from that raw milk. Now in modern day, these are unpasteurized milk that they had. It could be heated just from, like heat on the fire in the backyard. But what we are familiar with and what we grew up with is the process of pasteurizing milk. And so pasteurized milk is what we grew up on, as opposed to raw milk, which is what a lot of farmers in Canada and like traditional cultures grew up on. French cheeses, all that, they're mostly raw milk cheese traditionally. So we grew up in modern day Vancouver, pasteurized milk as opposed to raw milk. So the process of pasteurizing milk and the theory behind it arose from Louis Pasteur. This is a process involving high heat, extremely high temperatures to kill the germs in the milk, and it was thought to help prevent infections. This isn't in the article that I read, but I remember when I learned this years ago. Louis Pasteur was heating the milk to high temperatures to pasteurize the milk in order for efforts to kill the germs and stop spreading of smallpox, stop spreading of tuberculosis, and this is thought to be those pandemics or infectious diseases at that time. And so their route to dramatically change everything, the way that food was processed, was to now pasteurize the milk under the scientific studies of Louis Pasteur. So his theory was that germs are bad and we must kill the germs in order to protect our health and vitality. The theory applies to germs, viruses, bacteria, I'm sure parasites, everything in the basis of Western medicine. So outside is what we have to protect ourselves from. In the 19th century France, Louis Pasteur was proposing that the germ theory and pasteurization of milk is in order to prevent disease transfer via the milk, or infectious transfer. So then an opposing point of view came to light, and another French scientist named Antoine Béchamp, and he was introducing and advocating for the cellular terrain theory, which is the way I treat and the way we treat at Brio, which was completely opposite to Louis Pasteur. Béchamp noted that these germs are everywhere. They're all around us. They're in the external environment. They live in our skin. They live in our bodies, and they live in a harmonious way in our bodies with our inner environment. However, he noted that these germs, just like the mosquitoes, they're all around, but they, and the flies are all around. How do they know when to come to the swampy water? How do they know when to come to the toilet that has been totally left neglected? It is because of the diseased state, or that lower level habitat. So he's saying that these germs are opportunistic. They can live symbiotically in our environment, on our skin, in our gut. They can live in harmony, but they are opportunistic, waiting for the diseased state. So he noticed that only when the host tissue became damaged or compromised, that these germs then transformed and began to thrive on the new diseased tissue. So they're within us, but they start to thrive in an infectious state when that diseased tissue forms and becomes damaged and compromised. So here lies the onset of the symptoms. So the germs were the symptom of the disease, not the cause of it. So the diseased tissue is already happening, and then the germs are on top of, or drawn to, the diseased state. So the germs are a symptom of the disease, not the cause of it. So therefore, Béchamp argued that to prevent illness, it is not via killing the germs, but rather to cultivate health via diet. This is like 19th century. Cultivate health via diet, hygiene, lifestyle factors such as fresh air and exercise. I would add to it the mental emotional component that is so huge right now. You know, the egoic mind, the projections, the control that we have on ourselves, pain, trauma, all of that. I would argue that for sure as part of the cellular terrain. He argued that if a person has a strong immune system and good tissue quality of the cellular terrain, the germs will not manifest in the person and they will live in good health. Does that make sense? This is like two opposing thoughts. So Antoine Béchamp and Louis Pasteur. Louis Pasteur is about germ theory. Antoine Béchamp is about the cellular terrain. So it is when their health starts to decline due to personal neglect and poor lifestyle choices that they become susceptible to the infections. So he's saying that the infection is the red flag of the decline. And so in our modern world, we only treat the red flag and we never go deeper than that. So he argued that if a person has health that's starting to decline due to personal neglect and poor lifestyle choices, they will become susceptible and vulnerable to infections. So the infection is the red flag of a deeper issue, not the cause of the deeper issue. This is often like, you know, a person in a hospital. Everything is within us. We have everything within us. It just needs the right environment to become opportunistic. So you have a person in a hospital. Hospitals are pretty sterile, I would say. Some are not, obviously, but a person goes into the hospital. It doesn't move for days and days and days at a time. Now they are susceptible to bed sores. You know, where did that come from? So that is not from the outside in, it is an inside out state because they're not moving. There's a compromised tissue. And another talk I heard about this woman, she also discussed heavily on the cellular terrain, but she had her own mechanism of treating it. She was a scientist. I totally forgot her name. I can find the podcast somewhere. I don't know. I don't know where I heard it. But she argued as well, like even when there's a dead body and it's not put in the refrigerator right away to wait for the funeral process or whatever it is, there can be maggots that come in. Even if it's in a sterile environment, where do the maggots come from? This can be cultivated from our disease state of our inner world. The opportunistic pathogen can be triggered. So that's what she was talking about too, the maggots, you know. It's not that they live in our body, but when the state is cultivated, it can be triggered to transform. I think maybe that's just like fruit flies too, because those aren't in the house, and all of a sudden there's this disease state of the fruit, and then these fruit flies are they're like transformed and cultivated. So does that make sense? That it's a transformation process of the disease that's already going on. So he Béchamp stated that the disease that the person could that a person could restore health via health, diet, hygiene, and detoxification. I think it's cellular detoxification. That's what I focus on. So it has to be specific. Cellular detoxification. You can't just eat a super clean diet and treat your cellular terrain. It doesn't work that way. The infection went away on its own without needing measures to kill the germs. So this is quite the battle of thought where Louis Pasteur, the germ theory, versus Antoine Béchamp, the cellular terrain theory. Well, Western medicine is founded solely on the science of Pasteur's germ theory. I don't know if it's just Pasteur, but it's all about the germ theory. And Béchamp is not really spoken about, nor do many know about him at all, and his teachings are really forgotten about. So Béchamp is quoted also as saying, "Nothing is lost, nothing is created, all is transformed. Nothing is the prey of death, all is the prey of life." So that was a Béchamp quote. That again is like the bed sore example, or the maggot of the decomposing body example. So at Brio, our philosophy of care is really based on Béchamp. However, the cellular terrain theory may require elements of the germ theory. Many patients do require pharmaceuticals to treat infections, antibiotics, whatever it is, and we can still work on the germ theory and the cellular terrain theory together. Because we are really a profoundly unwell society. We have gone very far off of the body being self-regulating, and so we do need to treat the germs, because they can lead to a wildfire if a person is in a very diseased state where their tissue has not been treated, and they're severely compromised with just the cellular terrain is not healthy. In a pretty healthy person, you can often forego any pharmaceuticals and treat at the cellular terrain, and they will restore back to wellness. Even in an acute state, they will, like, you know, they come in with an infection and you treat the cellular terrain and they will be extremely well. But when a person's really pretty far gone, there has to be pharmaceuticals in the mix too, and then start to treat on the cellular terrain, and then eventually years and years into the treatment they will not really require pharmaceutical when they get sick. So the more we restore the cellular terrain, the germs become less and less of a focus, and this is true to Béchamp's findings. So the 4 levels of healing that I've kind of come up with and denoted: the weeding, seeding, feeding, thriving. You can see it on our cartoon. But the first 2 phases, weeding and seeding, is heavily focused on germs, and a person may need pharmaceuticals because depending on the person, but they could come in pretty compromised when their symptoms are quite severe. So guidelines set by Béchamp, and this is a philosophy that I always use, is treat the patient, not the infection. When the infection is just treated, you haven't treated the patient, you haven't changed the swampy water, you haven't cleaned the toilet. That is the treating of the patient versus just the infection. So ironically, at the end of his life, Pasteur, the germ theory father, admitted that he was wrong. Apparently he was also caught for plagiarizing a lot of Béchamp's earlier work and then just switched it to the germ theory. But at the end of his life, he admitted that he was wrong, and translated from French, he proclaimed, "The microbe is nothing," meaning the microbe is a germ. "The terrain is everything." So that's on his last words on his deathbed. The father of the germ theory agreed that the microbe is nothing, the terrain is everything. So he admitted about Béchamp's philosophy of care. Pasteur's theory allows for much more of a capitalistic gain. There's millions, if not billions of dollars made on the germ theory. So just think about it. You know, if everyone followed the cellular terrain theory, pharmaceuticals would not really be so much of a fear factor. Even a natural antimicrobial. So a lot of times when people are taking supplements, they're using the germ theory still and using a natural supplement to try to use the germ theory. It's no better. It doesn't matter. Why don't you take the pharmaceutical? Sure, there may be less side effects, but still you're not treating the deep cellular terrain by taking the supplement. So there's millions and millions to be gained by following Pasteur's germ theory, which is why not many will talk about the cellular terrain theory. And I'm not dismissing the germs, because when a person is so out of balance, you have to dovetail both. But the germ theory does not at all even remotely close to think about the cellular terrain theory. We will include both, but my main focus is always get to the cellular terrain. So there's millions and billions made on pharmaceuticals and now natural antimicrobials, and it's the same thing whether it's a natural or a pharmaceutical. You're just treating the red flag, you're treating the germ. It will not result in long-term wellness and deep cellular terrain repair. It cannot and will not ever result in deep wellness. So what is cellular terrain healing? The basic premise, a healthy human body is a balanced system, and that is auto-regulating and self-regulating. When we are no longer a balanced system that is auto-regulating and self-healing due to exposure of overwhelming toxicity and exposure to toxicity, that's usually when we're not balanced, is when there's too many toxins coming in for our body to handle it. So the cellular terrain theory is the soil or the cellular environment, the biochemical environment, the energetic environment of the person or organism. It is dependent on the highly optimal functioning of our emunctories. So this is the whole premise of my practice, is focusing on the emunctories. What are the emunctories? So the emunctories are our routes of elimination. We have 4 main emunctories, primary emunctories: our breath, our perspiration, our bowel movements, and our urination. If any one of these are compromised at a cellular level, there will be a backup of toxins, and then you have setting up the cellular terrain for a diseased tissue and infectious state, immunocompromised. So we always have to make sure that the emunctories are open and treated. Otherwise, your body will use secondary routes of elimination. Then you have like toxins deposited in the joints. You have sinus infections, you have chronic yeast infections, you have asthma, eczema, all that. Those are secondary ways of your body trying to eliminate toxins, and it's not efficient. And it is going to result in diseased tissue and therefore more susceptibility to the germs. So we have to treat the emunctories and make sure that the emunctories are very much open and the primary routes of elimination. Think of a bucket and you have all these toxins coming in, and then you just have a little nozzle to get the toxins out. So the amount coming in, and then the little nozzle to come out. So the little nozzle is the emunctory. We got to make that emunctory big and primary. Otherwise, the toxins coming in will just spill over into other tissues, and that's when we set ourselves up for a disease state. So toxins can come from pollution in our outer world, electromagnetic frequencies. We're on so many devices and we have so many things plugged into our homes. Trust me, if you think that doesn't affect you, it does. Our food choices are not optimal. Our farming is not optimal. Our food system is highly affected and infected. There's trauma states, stressors, heavy metals in our environment, in our products. What did they say? There's like 243 toxins found in the core blood from an umbilical cord of a newborn. That's a newborn. 243 toxins found isolated from a newborn, from the umbilical cord blood. There's pharmaceuticals that are toxins. There are external hormones that are toxins, drugs, alcohol, all those things. And there's so many more. Those are all, imagine toxins coming into that bucket, and then you have that little nozzle to get them out. When they can't get out, it will pour over into other systems, and we are setting ourselves up for a disease state. When the emunctories are big and primary and we can get things out, This is when our body can auto-regulate. That's the basic premise of what I said at first. The human body is a balanced system that can auto-regulate and is self-healing. Every organism in nature is self-healing, and we get off balance because we are just so toxic. We cannot get the toxins out of our body fast enough in order to self-regulate. So when I'm treating with remedies, and I use the Unda remedies, and anyone who's ever treated with me will know that I exclusively use Unda remedies, I'm getting out the toxins, and then the vital force of the person is starting to help heal them. The remedies aren't necessarily doing the healing. They may be providing more energy for a person to heal, but they're at the profound level are deeply detoxifying and optimizing the emunctories, and then the person's own vital force will start to auto-regulate and self-regulate. So it's like being the sweeper off the path, like you're clearing the path for somebody and then they can just walk through it, versus creating a path or, you know, whatever it is. But that's the analogy, is just like clear the path, and then the person's own vitality, which is an innate characteristic in us, is to self-heal and self-regulate. In our modern world, this sounds terrible, but it's the truth, and it's nothing that can't be corrected. So don't be like, well, I'll just stick to the germ theory because it seems so much more complicated. But I have to share this with you. In our modern world, we are born into imbalanced terrain. This is totally my case as well, and I'm assuming that it's just getting worse. But there can be poor diet choices for the parents. Medical interventions at birth affect the cellular terrain, whether they're surgical or medications, whatever it is, needed or not. It's not about judgment, it's just facts that they will affect the cellular terrain. There could be pharmaceuticals given at birth, lack of breastfeeding, exposure to all of the above toxins that I just mentioned, the EMFs, the heavy metals, all of that, pharmaceuticals. The new baby and the cellular terrain of the new baby is set for imbalance. Just like I said, 243 toxins found in the umbilical cord blood already. That affects the cellular terrain of the baby. Lack of regulation. So the baby is set for an imbalanced cellular terrain, and now it cannot regulate itself, and then it's like lifelong dependence on the Western medical model and the germ model, always chasing the germs, and it's probably medication after medication after medication, which was my health history. I think my file was like this thick by the time I was like 10 years old. I was at the doctor all the time. And the neglection of the cellular terrain since preconception. And so the moms I treat, they always ask, are these Unda remedies good for, or safe while I'm trying to get pregnant? I'm like, you will totally have a different cellular terrain for your baby if you do this, and if you take a bit of time to prep, maybe even 4 months, just take this time to prep, heal what you're coming in for, but you're also prepping for pregnancy, and it will be a different cellular terrain for the baby. So the cellular terrain can be neglected for generations. It can be one generation, but it's preconception. So it sounds hopeless and dire, but it is far from. Even if the stage was set for complete cellular terrain shutdown, just like mine was from birth. Actually, it was started at 2, so it was, you know, an accumulation, in which the overflow happened at 2 years old. There's absolutely ways to treat and heal at every milestone of existence, and this is the core philosophy of how I treat. This is why I use the Unda remedies. This is why I exclusively use them. So most people come in and they have this preconceived notion of how to heal. They're very happy with the fact that they're coming in and they're already on supplements that they've chosen. Supplements may be good quality, but most of the time they're like super crap quality, and then they're putting more crap into already a compromised system that emunctories aren't open, they aren't able to detoxify, self-regulate. They're putting more crap into the system, and then you know, especially when I first started practicing, people would get upset as to why I didn't want to supplement. Well, I'm trying to heal at the cellular terrain level, and then when the cellular terrain is healed, we can pinpoint and put in certain supplements that would be great for long-term maintenance, in addition to always affecting the cellular terrain. But putting supplements into a cellular terrain of our modern world Well, you'll feel better for a little bit, yeah, but it's still using the germ theory of like, let me just treat one symptom and see if there's a difference. When the cellular terrain is so multifaceted. It's taking the person as a total individual. How do they respond to detoxification? There's 4 different body ways of responding to detoxification. You have to know each way. You have to know their temperament. Do they like cold? Do they like hot? How is their food digested? What is their personality? What is their traumas? What was their birth story? What was their family history story? I'm looking at all of that when I'm treating the cellular terrain, because you're navigating all of that with each different choice of remedies. And so I'm thinking of a Rolodex of multi-layers of things as I'm treating the cellular terrain, and to come in and think that one supplement or one pharmaceutical will treat anything. Maybe it will buy us time, it'll give us space, but it's not going to result in long-term wellness. So I would save your money on self-treating with supplements, because it's not treating at the cellular terrain level. Yeah, so this is why I use the Indas, because they're all based on a cellular terrain, and the European way of treating is all usually the doctors that come to treat how I learned how to treat, they're all from Europe, and they're medical doctors, so they had to take additional training in order to treat via the drainage remedies, but they're usually medical doctors, and that's just how they treat. There is, you know, if you wanted to do an alternative therapy such as drainage, you have to be a medical doctor first, and so they're the ones who come teach us, and they're teaching us a lot of these, like Antoine Béchamps and Rudolf Steiner, who's German, I believe, Austrian. He's Austrian, but the Unda remedies are set on his philosophy of care. It's how the body energetically develops. It's also the theory of Waldorf school and how the child's brain develops. So his philosophy was deep and very nuanced. So that is, so when the cellular terrain is balanced, you can be exposed to the millions and billions of germs every single day, and you will not be susceptible. Others in the home may be sick, you will not get sick. You will be exposed to the bacteria, viruses in your environment, but you will ward it off. You have maybe been to a resort and your friends got the parasite, you will not get it. You will go for a hike and other friends are laden with mosquito bites, you will not get the mosquito bites. You will be of high vitality, high energy, high resilience. Will you still get the cold or flu annually? Sure, yes, but it's a priming of your immune system, and you may get a fever, which is a good thing because it's like tuning up your immune system, but it will be high fever, it will be quick, maybe lasting 24 hours. You're still under care, so you know that it's not, you're not just being neglectful with your health. You know what your body's response is, and it can be a high fever, 24 hours, and then you're back to wellness. And this is via self-auto-regulation. So you will see the difference because there will be no susceptibility to whatever the external world is. And it's not about bubbling yourself against the germ. It's about treating the cellular terrain. So it's a total different philosophy of care. If you apply it at all, I don't want to get my video taken down, but if you apply it at all for what's going on right now, think about it. Just marinate on what is going on with the difference of the germ theory and the cellular terrain theory. Do we need to do a bit of both? Yes, I usually do both, but the germ theory only considers one side of the equation, which is just the germs, and put the person at war with the external environment because you can't drain the swampy water. Have I seen people with pictures with masks on and buying 6 bottles of 2 liters of Coke, and you know, quite obese, and what is the mask gonna do? There's 6 bottles of Coke that you're sitting there with on your checkout counter, and there's no talk about that. It's only talk about the germ. And so I'm not saying don't follow what anyone says. I think this is a unique situation that we're in. Follow, because in the cellular terrain theory you can weave in the germ theory too, but there's more to it. It's not just about bubbling oneself up. So another quote to finish before I can take a few questions. This is an hour. This is awesome. I thought it was going to be like 2 hours. When a flower doesn't bloom, you fix the environment in which it grows, not the flower. So that is Alexander Den Heger, also a European, I think, motivational coach. So this is not an old century quote. This is, I think, more modern. But he says, when a flower doesn't bloom, you fix the environment in which it grows, not the flower. That is the whole premise of cellular terrain theory. Is there any questions? Does that make sense? You can throw up some comments if it makes sense. I have time to do a Q&A, even time for likes, hearts, whatever. That was a lot to process. This is not about making anyone feel bad. It is not about confusing anyone. It is about giving you the real facts, and sometimes, you know, we're not given the full story, and it's up to us to research what the full story is. And this is, you know, pandemic or no pandemic, since we opened Brio in 2008, this is how we treat. This is Cellular Terrain. We treat as a Cellular Terrain clinic, and it is a difficult way to cultivate a practice, because everyone wants the germ theory practice because it is quicker, it gets results, and you're playing into the patient who is the paying customer who wants quick results. But I can't do that. I can't play into what they want, and I know that the patients who seek what we have to offer will find us, and they will be extremely happy with their level of care, and the level of toxicity that we're so exposed to will be minimal compared to doing the quick supplement germ theory treatment. So that's my level of care. I might go a little bit too far, like Dr. Jeff wanted to have IVs in our clinic way earlier than we did, and I was just really intent on setting up the clinic as known as root level cellular terrain theory, because I didn't want to get caught into doing the IVs, which would not really, like, it helps at that initial stages of healing. It helps at that initial stages of healing. There's a question, I'll get to it. But it doesn't fix the cellular terrain, so I didn't want to be known just for doing IVs. But once we established our reputation, and now we put in IVs, and I'm happy to have the IVs in the clinic because I know where they fall. I know what level of care it falls into, and I'm not gonna subscribe to a person doing IVs every single day or every week for like months and months on end because their cellular terrain is so trashed and they can only get out of bed with an IV. That just won't happen. So we won't allow that to happen. It's very nuanced, it's very prescribed. We are guiding that process. We don't really allow patients to come in and just off the street and come in for IVs. They have to go through the process so we can start to treat the cellular terrain. And then if an IV is necessary, we will do that. But you know, that may not be always the case. There's IV clinics popping up everywhere, not just naturopaths, but everywhere. And are you really treating at that deeper level? It's a good start, but it's not deep enough. So that's what I would say. It can fortify a total depleted system, but we really, really need to get at that deep cellular terrain. Just wondering how anxiety works with this. Is it just a weed? Anxiety is a presentation of, I think, the deeper cellular knowing. Maybe not a toxin, but it could be a mental toxin or spiritual toxin. You know, the root level of the anxiety is the symptom, yes, but it's a red flag for something that is deeper that may not be processed yet, if that makes sense. And it will process when the body is ready for it. It can take years. Sometimes we're not ready to process that deeper level of the wound. It could be linked to food, yes. It could be linked to hormone imbalance, yes, definitely. It could be linked to toxic exposures, EMFs. All of that has to be included and treated for that toxicity. And if it is all treated and balanced, and then the root is the mental emotional, that could take a bit of time. but all of it, everything in health can contribute to it. We all have our different weak spot. So one person's weaker spot of how they display their imbalance could be nervous system. Mine was always lungs and gut. Somebody else could be sinuses, somebody else could be hormones. So whenever their stressors hit, it goes to their weaker spot. So if all those toxic factors can affect your nervous system, plus if it's linked to root trauma and soul stuff, that just takes time. I think hopefully that answers. Is there any other questions? Does this make sense? Does everyone love this topic as much as I do? I love this topic. It is such a good one. I hope everyone loved it. I could talk about this like every week. I think Donna liked it. Awesome, Donna, I love that you loved it. You explained that very well. Great analogies. Awesome. Thank you, Siffy. And that means a lot coming from you, especially, you know, there can be fierce kind of camps of what we're saying. But just think about it and why people don't want us to know that there's the cellular terrain. The germ theory makes a lot of money, and I'm not denying it. There's a use for it, but will it lead to long-term wellness? Probably not. So that's all I'm saying. And it's never us or them, or, you know, I only do CrossFit and you guys do that. Like, it's not about that. Great topic and fantastic explanations. Awesome, Donna, I loved it. Good, I love this topic. So I think it's very needed, especially with right now what's going on. And when you look out in the world with what's going on, and how to protect yourself, it is just, yeah. And then you think about this talk, maybe watch it again. It's very fascinating. That's all I can say. But cellular terrain, it starts from the soil, it starts from birth, it starts from our food systems, our pollution, all of that. All of that is included, you know, that all plays into our cellular terrain. Do we go out in nature? Do we touch the ground with our feet? Do we play outside? Do we get dirt in our mouth? Because there's so much protective mechanisms of dirt and dirt molecules. So I can't even speak. So it's like this big synergy, this big symbiotic relationship we have with the world, and we're just isolating into one little germ, and that doesn't make any sense. Any books you can suggest to read about this? You could look up Antoine Béchamp's, how do you spell his name? I think it's B-E-C-H-A-M-P. And a lot of the Rudolf Steiner books, I haven't even purchased them. He is totally like my philosophy of healing is Rudolf Steiner, and I haven't even purchased those yet because I think they're very deep, and that's on my go-to list. But Rudolf Steiner and Antoine Béchamp's, you could look at that. They're hard books to read. Antoine, B-E-C-H-A-M-P, so B-Champ. So Béchamp's, and you can look up Louis Pasteur and Béchamp's, and then you can just Google germ theory versus cellular theory. I call it cellular terrain, but when you look it up, it's just cellular theory. So germ theory versus cellular theory. Anything else? Hopefully this helps when you're out grocery shopping. You know, think about your cellular terrain and have you treated it or not. It will really help take a lot of that fear and anxiety down. Another part I didn't talk about, but exposure to viruses and bacteria is how we define ourselves. It's how we define self versus non-self. So from 0 to 7 years old, this is a whole topic on its own. Rudolf Steiner, he is the father of anthroposophical medicine, which is how the body energetically develops. Of course, when you're 0 to 7, your gut is already developed, but energetically develops. 0 to 7 is a differentiation between self and non-self, and all the child has to do for their job is to get sick and not sick, and sick and not sick, and sick and healed, sick and healed, sick and healed. So that's how this child differentiates and individuates. So these viruses and bacteria and our exposure to them is what makes us who we are today, is what helps individuate us. And now the germ theory is stopping all of that. And when the body doesn't know self from non-self, it sets the stage for autoimmune conditions. So at 60 or whatever, there could, I'm not saying every single person, but that's part of what sets the stage for autoimmune conditions, is the person does not know self from non-self. It has not been established. It is not clearly defined. So, yeah, so it's not that we need to fear the outside world. It's what helps shape our reality. Our bodies is so smart. Our genes our cells are so smart in how they adapt and how they just adapt to the new world and our exposure, what we're exposed to. And to keep it in this like fragile little bubble world is not how we grow our immune system. So that's what I'll leave with, basically. Any last comments or questions? Anything else that we can leave with? So Donna's throwing up some hearts. Thank you for staying till the end. I know that was a heavy topic. I'm glad that it resonated with whoever caught it. It's a good one. So it's like this is really all you need to watch, and then the rest of health just, it will make sense. This talk is really all you need to watch. Everything else is like, this is the root, really. Thank you, everyone. Thank you for spending your Saturday long weekend with me, and I loved it. I love this topic. If you feel like anyone is super fearful, please send them this talk. It'll be on YouTube. And when it creates a bit of anger in people, you know that you kind of hit on something, because it's not what we're taught. So people can get angry with this too, and it's not to make anyone wrong. It's because it's just that we don't know. So when we know alternate thought process, we can look at our lives a little bit different. It's not about making anybody wrong at all. So it's just expanding how we look at all sides of the coin. All right, thank you, everyone. Have a great long weekend, and I will talk to you soon. I think my next talk is next Friday, so tune in for that. Thanks, everyone. Bye.